Hello, my name is Professor Raj Persad. I'm a consultant urologist of some 30 years experience working in Bristol. Today I'd like to talk to you about male sexual health and the particular aspect of testosterone and its importance. Testosterone is produced by the testes mainly, and it's an important hormone amongst all the other hormones that one has in one's body for the development of sexual characteristics and for male sexual health. More important than that, it has a general role in maintaining things like glucose regulation, cognitive function, musculoskeletal function, and even heart function. So, apart from just having its aspects of producing sexual drive, vim, and vigor, it is important for overall health of the male. What can cause lowered testosterone? Well, there are a whole range of genetic considerations that can lead to low testosterone secretion and infertility. There are things like mumps orchitis or mumps infection of the testes that can destroy testicular tissue and lead to low testosterone production later in life. And there are conditions such as diabetes in which testosterone can be reduced because of the increasing amount of body fat that tends to chew up testosterone. So given that there are lots of causes, there are lots of treatments, but let me deal first of all with the sorts of symptoms that one might get, particularly in males who come to see myself, a urologist. In particular, I treat prostatic diseases and sexual function. And testosterone is an important consideration in these areas. The typical patient may approach me with saying that he's losing interest in sex, losing his libido. He may in fact be losing strengths of erections as well. Coupled with that, often there is a low energy level, even sometimes depressive feelings, and mood changes, lowered mood, and even patients might say they're kind of so tired that they fall asleep in front of the TV in the early evening, well before bedtime. So one can diagnose this low testosterone of the aging male by a combination of assessing symptoms and also measuring the testosterone level. There are a number of different ways of measuring the testosterone and looking at its bioavailability in the bloodstream, but I won't go into that just yet. Once diagnosed with low testosterone, one can actually treat this, what we may do as urologists is offer patients supplementary testosterone with topical agents, which are various ointments and creams that are rubbed into the torso of the body daily. Or if those are not effective, one might use depot injections once every few weeks or months. These are injections of testosterone deep into the muscle, which then get leached into the system and are released very slowly without the need for daily application. We don't tend to use testosterone orally because it is not as effective that way, and the testosterone hormone might get decomposed in the gut, producing not much benefit. This treatment can be life-transforming. I have many patients who they've suddenly developed this spring in their step, increased sexual function, and we know that increased sexual function and a regular cycle of sexual health does tend to lead to greater cardiovascular health and therefore greater longevity. Now, it's very important that the treating urologist does not only reach for his prescription pad and his medicines, but in addition to treating with testosterone, one should encourage the patient, if they're sedentary, to do more exercise, certainly to give up smoking, And in fact, the sort of exercise that one might do is the sort that is muscle building, because we know muscle mass produces greater testosterone. And of course, to advise patients who are diabetics to keep better control of their blood glucose. And in fact, increasing the testosterone, increasing the lean body mass, and lowering the fat content of your body does improve glucose regulation. So testosterone is indirectly very important for glucose regulation. I think that's probably enough to talk about, but just to say it's important that testosterone, when you are being treated with this, is monitored regularly to keep you within the physiological range that is of benefit to you. Thank you for listening. My name's Raj Persad.